good afternoon, and good evening. Welcome everyone to today's IFA Global Café. My name is Katrina Bazanis. I'm the Director of Policy Advocacy and Innovation here at the IFA. And so today's session is very timely in light of World Immunization Week, which is taking place from the 24th to the 30th of April. And this annual event is a timely reminder of one of public health's most powerful tools, vaccines. This year's theme is Immunization for All is Humanly Possible, and it calls on all of us, government, civil society, health professionals, and communities to expand access to vaccines, close immunization gaps, and ensure that no one is left behind to ensure dignity, equity, and the right to health. For older adults and those with chronic conditions, immunization is an important aspect of healthy aging and maintaining good health into later life. And for older people, the risks posed by infectious diseases are heightened. And as immune systems age, or a process known as immunosenescence, the body becomes less effective at fighting infections. And vaccine-preventable diseases like influenza, pneumococcal disease, shingles, and COVID-19 can cause severe complications such as hospitalization, the loss of independence, and even death, but also may just make it difficult to return to full health after experiencing an infection. It is important to have practical tools and clinical guidelines in addition to robust policy to ensure vaccine uptake and coverage for older adults. And part of this conversation is ensuring trust and confidence in vaccination and ensuring resources exist to support pathways to immunization for older adults. And so pain management is one of the under-recognized part of the vaccination process, which may be a barrier to being vaccinated. And so speaking with us on this topic is Professor Anna Taddio. So Dr. Anna Taddio is a professor in the Leslie Dan Faculty of Pharmacy and inaugural GSK Research Chair in Vaccine Education and Practice-Oriented Tools at the University of Toronto and Senior Associate Scientist at the Hospital for Sick Children in Toronto. Her program of research examines the short-term and long-term effects of pain and pain management with a focus on vaccination. But secondly, the effectiveness and safety of pain management interventions, and thirdly, evidence-based practice and implementation research. Dr. Taddio has authored over 250 scientific papers and book chapters and is the recipient of numerous awards recognizing her scholarly and advocacy contributions to pain. And today she'll be talking about managing pain during vaccinations with the CARD system, which is a practice tool to help providers systematically integrate the research evidence into practice. So welcome, Professor Taddio.
Yeah, it's great to be here. Great to see so many people on the call too.
Thank you so much for joining us today. So we always sort of like to start at the beginning and learn a little bit more about you and your career and your background. So can you tell us a little bit about yourself and what led you to your work in pain management?
Yeah, sure. That's a great question. So my background is I'm a pharmacist and I worked in the hospital setting. So for anybody who's been in a hospital, sometimes we do things that can hurt people as part of medical care. There's lots of different medical procedures involving needles. I happen to work in a pediatric hospital, so a children's hospital, and saw children undergoing procedures all the time, which was very stressful for them and for actually us who were there watching and witnessing. So kids were afraid, but also they were experiencing a lot of pain. And at the time that I graduated, which was the end of the 1980s, beginning of the 90s, is when I was working initially, or at the beginning of my career. We weren't really doing a lot at that time to manage these needle procedures. But there were some medications that were coming on the market that were being studied. Topical anesthetic creams is what they're called. And I had an opportunity to get involved with that research and then started to do more research with those medications and other medications to try to take away some of this pain from the needle procedures that are just everywhere going on all the time in the hospital. So I did graduate work, and then after I finished, I continued to do research in this area.
Thank you so much. And then, so what sort of particularly kind of inspired the work on pain and fear management during vaccination, and particularly for older adults?
Yeah, so part of the research was to look at whether, these medications were helping to make pain less. But other part of the research was related to seeing whether pain actually was bad. in the long term. So beyond the immediate event where we know we suffer if we have pain, it's very unpleasant. But I was looking also at long-term effects and discovered in babies that if their pain wasn't managed, they actually had bigger pain responses to future pain. So there seemed to be some neural memory of the pain, and it changed how they reacted in the future. And then I started to think, well, okay, what's happening maybe in older children or adults, and started asking people questions again in different studies about the impact of pain, and discovered that a lot of people were actually saying that they avoided vaccination or delayed vaccination either for themselves or for their children because they had concerns about pain or fear. So then this kind of brought me to the space of, vaccination, to say, well, we're all exposed to vaccination. How about we do something about this and take away this barrier? So then I spent a lot more time researching ways to reduce pain specifically during vaccination, and then trying to get the information out there. So CARD is one of the ways to try to help people to know how to integrate what all this science, or what all the research that we have done and others have done tells us, to try to make this a better experience, with the ultimate goal of reducing suffering, because this is a side effect of vaccination, even though we don't really think about it that way. It is. People have pain, but there's something we can do, and we can avoid people having these negative experiences, which make people have kind of negative memories about vaccination and negative thoughts about healthcare providers. So if if your pain is not being treated, or you had a bad experience, you kind of link that to the people who you were with that let that happen. And so this then can possibly affect the way you look at vaccination. It becomes one way to dismiss vaccination. And it's not a necessary thing. Like, there's lots of stuff we can do. It's easy. It's not rocket science. Doesn't cost a lot of money. So let's just try to change that now. And especially now that everybody knows, we just keep getting more and more vaccines, which is great. But we also increase the burden of pain and increase the possibility that people have negative experiences, reactions, and those sort of things that make people not so eager to line up every time they are offered a vaccine.
Mm-hmm. Yeah, I think it's an important topic, particularly in the sort of landscape of a lot of vaccine fatigue, vaccine confidence, loss of vaccine confidence. So can you comment at all on how kind of pain, fear kind of connects to those trends that we're seeing?
Yeah, sure. So we don't think there's actually much of a difference in the impact of pain or fear across the lifespan. So we don't have specific information for older persons, but when we look at surveys that have been done kind of across the lifespan, whether it's children or whether it's adults, about 5 to 10% of people say that they avoid or delay vaccination because of pain or fear. So we kind of got this happening. In terms of why would this be bad? For several reasons. So one is what I said before, pain is a side effect. So if we have side effects to treatments, we don't use those treatments sometimes, right? So if I had a bad reaction to a vaccine before, I might not be so eager to get another one in the future. So just having a side effect is something that's going to make people be hesitant to want to engage. Another reason is what I was saying, is about how we are treated by healthcare providers. So again, if we feel like we're not being treated well, and at a very basic human level, all of us would like our pain and suffering to be diminished, or the pain and suffering of our loved ones to be diminished. And if these basic needs are not met, it really makes it hard for us to want to go to get this kind of care when we think that somebody really actually doesn't care about us, right? So when we have our pain and fear treated, it's kind of a basic need that we have. So if we think somebody's not giving it to us, that's a way for us to kind of dismiss those people, their opinions, and then not want to engage with them. And then, if we think more broadly how we set up vaccination clinics and a lot of our healthcare, it's not really always meeting the psychological needs of those who want to get the care. So we set up the clinics sort of more to be suitable for those who are giving the vaccines or planning the vaccines, less so for the patients. And all of us probably have experiences, for example, during the pandemic, If we went to get vaccinated, we had to go to large rooms. We were standing. It wasn't comfortable. We were watching other people get vaccinated. Most people, if you ask them, would want to be vaccinated in private. They don't want to see other people. If you had children, you would have to go to spaces where other children might be screaming. Needles are in full view. Places are often cluttered, dirty. These are all things that provoke fear. And actually, people have negative reactions. So people, get not only afraid, but if you're afraid or you become fearful, this leads to other side effects like feeling dizzy, having a headache, nausea, fainting. So occasionally these sorts of things happen, but they're all kind of preventable. They're all related to how we implement vaccination services. So we haven't thought about these things before. And I think it's because of up until now, a lot of the research has focused on getting the vaccines, right? Like developing these vaccines. But the part about delivering to people the vaccine, we kind of think, oh, that's not a big deal. But it is a big deal. So the more we learn about this, the more we say, hey, wait a second, we have some science here that we can draw on to make this better for everyone so that they have less side effects. So less people are also going to be fearful in the future, and that maybe more people will be accepting vaccination in the future. So we're not undermining ourselves, if you know what I mean, because if we don't pay attention to this step, we actually undermine immunization. Because we don't pay attention to the person who's getting the vaccine and what that experience is and how we can make it better. So that's kind of, I think, how it fits more broadly and how people accept vaccines. But, vaccine acceptance is also very complicated. So we make decisions about vaccines not in a scientific way, but sort of emotional and whatever's the most important driver. So if we think we're susceptible to some disease, then, we're more likely to get vaccinated, even if we're worried or we're afraid of the pain. And in the pandemic, people were doing that. So people who had high levels of needle fear still got vaccinated and they pushed through it, right? Even if it was hard because they were really worried about getting COVID-19. But other times people may not be worried, or maybe they're not as worried now. Or they don't get the flu vaccine because they don't think it's a big deal. So then, why would I put myself in a situation where I'm not going to have a good experience? Like, what do we do when we don't like something or we're afraid of something? We avoid it. So what, people would not come forward if there was not a compelling reason to make them come forward to get vaccinated.
Yeah, I think these are all super important points, and you're right. I think there's so many kind of emotional drivers of vaccination, and pain and fear is, so kind of emotional. And so I think these are all kind of really great points to touch on. And to your point, having the science to actually back up how we deliver the vaccines is really important. So I want to sort of move into some of the interventions that you've actually done quite a lot of research on. So can you explain a little bit about some of the interventions that can help to manage pain and fear? So with reference to sort of the clinical practice guidelines and then into the card system that has been developed.
Sure. So we, over the number of years, have done some studies to look at different ways that might be helpful to reduce pain, and then created clinical practice guidelines. So the clinical practice guidelines are about summarizing all the research evidence that there is on all the different interventions and then making recommendations about them. So the types of things are physical things like your body position and activity. Just to give you an example, most people will relate to the fact that if they're in a doctor's office and they're lying down, they feel more nervous than if they're sitting up. So there's recommendations about stuff like that, how to, make people less nervous, more sitting upright rather than lying down. This is actually a big deal for children because they're often, held down, lying down, which really increases their distress dramatically. So that would be something not recommended to be done. Other things are psychological interventions. So this is like related to your thoughts and behaviors. So some people, for instance, might want to be distracted during vaccination. If they take their mind off of the pain, then they experience less pain, they experience less fear, but not everybody wants to do that. So some people cope better when they're actually paying attention to everything. Drugs I already mentioned. So we have creams, topical anesthetic creams that we can use that numb the skin so that there's less pain. And then there's some stuff that the people who are giving the vaccination can do in terms of the vaccine technique. So one example is injecting quickly instead of injecting slowly over a longer period of time. So we have made reports about these things, summarizing what are best practices. And then this card system that you mentioned is a tool we created after we made the guideline to help people to understand how to integrate this information. So, the recommendations for what works and what doesn't work is like a laundry list, like the commandments, thou must do this, this, and this. But people who have never done this before, or who plan clinics, don't really know how to integrate all this information into how they do their work. So we created the card system as a tool to help people to do that. And what's cool about card is you actually don't really need to know much about the guideline. Even just knowing what the letters stand for, and card is an acronym, can give you lots of insight about how to reduce pain and fear. So C stands for comfort. So people can think of ways that make them comfortable. Like I said, sitting upright, bringing a support person with you. So, people right away, when you tell them how do you want to be comfortable, can have ideas for what they want to do. So C is for comfort. A stands for ask questions. So all of us are nervous when we don't have enough information. It makes us scared. So the A card, or the A letter of the word card, gives us permission to ask questions. So if we have questions about the vaccine, if we have questions about anything, we can get the answers, and that can maybe allay our concerns. R stands for relax. So if we start to get nervous, how do we calm ourselves down? What are some of the things we might want to do? And there's different ways people can be calm. So for instance, having a private space, closing the door, having some music in the background. These are all ways that make people be relaxed. And we all have these experiences. We know what this is like. On the other hand, music, if too loud, can actually be annoying and make you more nervous, right? So we all have those examples too, where we've experienced those things. So, you have to be careful how you do it, but just getting that idea that, hey, how do I get relaxed? What makes me relaxed? How would I like this to go is great. And then D is for distract. So I mentioned some people want to be distracted during vaccination. This is sort of the thing that a lot of healthcare providers actually rely on. They use something we call verbal distraction, where they talk to you, during the procedure. And this is great. But some people don't want that, right? Like they don't want to be talked at. So we have this really great one size fits all approach of how we treat everybody during vaccination. And for many people, that actually goes against their own coping, what they would do, what they want to do. And so this is where a card is so powerful, because if you just let people know this, and that's what we've done in the clinics, put up posters and show people these different letter categories, then they can be thinking how they want this to go. And by the time they get to the vaccination, they can tell the provider, no, this is how I'd like it to be, thanks. And then the provider can support them. So they have a more personalized experience and one that suits them. So card we've used now across all kinds of vaccination settings. We started it first in schools, then we moved, and during the pandemic, did it in mass vaccination clinics, pop-up clinics, hospitals, community pharmacies. We brought it to long-term care facilities and retirement homes. So we're trying to spread it. And with every place that we go, we, how do I say, customize the choices to suit the people who are there. So in the different letter categories you can imagine of card, if I say distraction for a child, that might look different than distraction for somebody who's older. So we work with the different populations where the vaccines are happening and get some idea about how they want this to be and what they want to be offered. So what can we give them in the spaces that we have that would allow them to have a better experience?
Mm-hmm. Yeah, thank you so much for that overview. And I do want to get into some of the different settings that you mentioned and the particular strategies in those settings. But I think maybe just a first question to kind of, oftentimes when people are going into, these types of settings, it's often very rushed. You don't have a lot of time with a healthcare provider. So do you have any advice for people that are kind of going into these settings, would like to request some of these things, but maybe are a little nervous already. They don't have a lot of time to, express exactly what they want. What kind of advice do you have for people that actually want to implement some of these different tactics?
Yeah, so from the a personal point of view, if you know about card, you can certainly use that information to direct the interaction. So this allows you to be less passive as well, right? So it's not just kind of this is happening to you, but I'm part of this process. I'm participating and I'm owning and taking care of myself in the ways that I can and I know how. So I think it's really good for people to let the provider know about their preferences. And if they're not prompted, and sometimes the providers will say things like, oh, do you want the vaccine in your left arm or your right arm? Like that's kind of as simple as and as extensive as that interaction goes. You would say whatever the answer is. And also, I'd like if you could this, if so you
Mhm,
could just mention a few things. If something requires a bit of planning, then you might want to tell people ahead of time. So you might book an appointment. You might, talk to somebody about some special needs that you have, and people would usually be accommodating.
mhm,
But it's hard, as you said, if there's a 5 minute appointment or people have not given a lot of time and it's kind of rush, rush, rush. But as much as you know and you can control what will help you, it is helpful to try to convey that in that little appointment when they look at you and say, do you have any questions? You say, well, actually, I have some requests. This is what I would like. In my experience, this helps me cope better. And I would appreciate if you could, do whatever. Close the door. I need my spouse here. I'd like a support person. Can
mhm,
they please come? Something like this. But it's okay to ask. And usually there's an opportunity for you to insert something if they don't offer, right? So
right,
there are things, but we have to your point, we have to feel comfortable to do that, and sometimes that's hard. If you have a support person with you, that can be helpful, right? Like you can have somebody who's there to help advocate for you, and it's
mm,
not about being nasty or being mean. It's just about politely speaking up, right? Because it is
mhm,
about you. And usually this is okay. People will accept it. I'll give you an example where it comes into the children's space. Okay. So we've done card in various settings, and one has been the community pharmacy setting during the pandemic. And it was at the time when everybody might remember that the vaccines became available for kids between the ages of 5 and 11. Okay. And they were doing this in the pharmacy. So pharmacy was now doing more vaccines, vaccinating kids. And it was actually quite chaotic. Okay. Because they're not used to doing this. It's very hard. And
mm,
vaccinating 5 to 11-year-olds is also challenging because they are fearful of needles, right? Um, so we introduced card to some pharmacies. And the way we did it there is we let the kids, and we do this with everybody, by the way, all ages as well. When the kids came with their parents and they checked in for the vaccination, we gave them, there were card posters. We said, hey guys, we use card in this pharmacy. We're trying to make everybody's experience as positive as possible. Let us know what you want us to do. How can we help you? What things you want to do? And we gave them a piece of paper, a survey, and we said, check off what you want. So we literally have like a menu. They select what they want. And then that piece of paper went to the pharmacist, and the pharmacist would interact accordingly. So it
mhm,
really streamlined the appointment. Okay. So
mhm,
it took less time actually to get vaccinated because the pharmacist wasn't trying to make a rapport, wasn't peppering the kid with questions in the moment when the kid is now nervous already because they know they're going to be vaccinated, but they would look at this sheet and say, hey, you said you want this, this, and this. Is that still okay? All right, let's go then. And that was it. That was literally the conversation. The person was acknowledged, right? They're
mhm,
now a person. So instead of talking to the parent, it was now talking to the child. And the appointment went according to the child. But what happens sometimes is the kid would pick on this survey that they wanted a topical anesthetic. Of course, kids would pick this because it's a medicine that numbs the skin. They're afraid whatever, you can give them that will make this better. They want it, right?
mhm,
And sometimes, so this takes about 20 minutes. So you'd have to find something for the children to do, which we did. We had a distraction station with all kinds of coloring pages and activities kids could do. But parents would say, oh, um, we don't need that, right? We want to be in and out. And we would really simply have a little conversation with the parent that says, you know what, this is what these medicines are for. We can accommodate this. We do it all the time. We use these medicines in the hospital. There's some things, if you don't mind waiting just a few minutes, you have to wait anyway, just 5 more minutes or 10 more minutes. And this can really be helpful. And we really want to make this a positive experience for your child. And I don't believe there was a parent that said, no, it's okay. I don't want you to make this a positive experience for my child. So, we also, it's not just the provider actually that can be difficult. Sometimes it's parents even that are more the bigger roadblock for their kids than the provider would be. So we have to maybe recognize our attitudes and assumptions about pain, these very dismissive attitudes that say, it's okay, suck it up, it's only a minute. It actually comes from everybody.
Yeah.
Right. And we can change this and we can help people, bring them to where we want them to be, to say, well, actually, this is important. I do want to have a nice experience. And it doesn't change much of anything. It's changing your perspective to be that this is not just about you giving the needle. This is really about them, the receiver of the needle. They're delivering health care, and it's about the person who's getting the care. It's not about me as the deliverer, right?
Yeah, absolutely. And I think a lot of the same, can be said about older adults, and just expecting like, oh, things are painful. They have to deal, you have to
Yeah.
deal with it. And, especially I think in settings where there's, older adults are probably going through a lot of different healthcare interventions aside from vaccinations. So I think
Yeah,
that's a
and
really
people
great point.
are really surprised that they should care about pain. I mean, it is true that older persons report less pain and are little less bothered by it compared to younger people, but that doesn't mean you can do things that you shouldn't do, or not
Mhm,
offer pain management like that. They don't equal one another, right?
mhm.
And there are people, even in our studies, who are older that pick topical anesthetics. So
Yeah.
in a retirement home that we went to, in a project in the like a few months ago, I guess it was this year's flu season and COVID season. Uh, One of our partners visited a retirement home and vaccinated about 40 elderly persons in that retirement home. Like 7 or 8% of them chose a topical anesthetics. So when given the choice, people would do that. My mother's afraid of needles. And if I go with her to get blood work, I put a topical anesthetic on her arm and she's very grateful.
Mhm,
Sometimes the providers are surprised, but too bad. As
mhm,
this is how I would like this to go. Um, it doesn't matter to you. What's the difference to you?
mhm, mhm.
I'm not, how do I say, interfering with your procedure. I'm not, making it take longer for you. We've come, we're prepared. And it's not really different than her saying, I want my daughter to come with me, right? Like that support person thing. So again, it's about respecting people too, at a basic level, right?
Mhm.
How do we show respect? Is what can we do to help that person get through this experience and have a positive experience? And in our own healthcare system, there's lots of ways to learn about how we can do this better with simple things, even like CARD. It illuminates a lot of deficiencies in our healthcare system about how we actually say that we're delivering person-centered care or patient-centered care, family-centered care, this sort of stuff, when actually we are not, because we
Mhm.
don't engage, we don't educate the patients about what their choices, their options are, and then listen to them about how they would like to control the parts of the procedure or the parts of the healthcare process that they actually can control, that is for them, right?
Yeah. Yeah, absolutely. So I want to maybe understand a little bit more about the different settings that you mentioned. So the difference between kind of implementing this in a pharmacy setting versus, you mentioned a retirement home, you mentioned long-term care. So can you share a little bit about, what are the different challenges and strategies to implement this tool in those settings?
Yeah, so that's a great question. So we have some experience, and the experience actually came partly because of the pandemic. So people did look to us and say, okay, you've done a lot of work. Most of it is in children. Do you think that this would be helpful in adults? And we said, we think so, but we don't know for sure. So we started, bringing card to different settings that included adults and also older persons. So one of the first places we went to was the mass vaccination clinics that, as I said, many of us have experienced because of the pandemic. And at that time, they were all so rushed. There was very little that could be done, that was trying to get the vaccines out as quickly as possible. So we focused on educating the providers about how to speak to patients, about how to engage patients, ask them, what could be helpful for them, and putting up posters along the clinic. So as you walked, through the clinic, you could see card, you could learn about card. So again, you could know by the time you reach the provider what sorts of things you wanted to do and how you could be made more comfortable. So we did that. So very simple, and still people's symptoms were reduced. There was less pain, there was less fear, less dizziness across the age span, so across the lifespan. We went to long-term care homes, and again, difficult. A lot of the patients don't really understand as well. So the approach was, again, to engage the providers who were setting up the clinics and say, okay, maybe there's some things you can do in the spaces to make it more comfortable for people. And maybe there's some things you can do with the injection technique that make it more comfortable. And as an example, well, I told you topical anesthetics. So they actually applied topical anesthetics to the elderly folks that they thought would benefit and those that asked. And they also removed the alcohol swab. So I don't know, people on the call, if where you're from, they use alcohol to wipe the skin before giving vaccine injections. And so the idea behind that is that we sterilize the skin so that there's no risk of getting an infection from the needle going through the skin and maybe bringing bacteria in the tissue with it. But in research that's been done, it's been found that this is not necessary. We don't need to wipe the skin with alcohol. There isn't a higher risk of infections. And in some parts of the world, entire countries do not use alcohol swab. So we use alcohol in Canada, but we don't need to. So one of the things that we changed in the long-term care home was to take away the alcohol wiping, which can actually maybe increase pain because people don't usually wait a long time from when they wipe the skin to when they poke. And you could be tracking the alcohol into the tissue. And everybody knows that if you have an open wound and you put alcohol on it, it stings. So it could actually make the experience worse. So we took that away. And a lot of older folks too don't like to be touched and manipulated. And, all this wiping and stuff is kind of irritating or can make them more afraid. So we took that element out. So we did some of these simple things, but also we had an education session. So in these retirement homes at the time, the long-term care homes at the time the pandemic was happening, we were arranging to do webinars where we would engage with the staff and patients who wanted to attend. So the organization would bring people together, let them watch this big TV screen, and we could answer questions. So we had a doctor who was an expert on COVID, talk to them about, again, this is the A of ask, right, of card, is say, hey, what concerns do you have, either about the vaccine or about how we're going to vaccinate you? Let's talk about it. Let's answer your questions. So we had that forum so people were more prepared and then again could feel more confident and relaxed when it was time to get vaccinated. So we did simple stuff like that. As we progress now, where we had more time, opportunity in the pharmacies, we could set up the pharmacy so that it was more amenable to vaccination. So pharmacies, remember, were never built for people to get vaccines in or for people to even get kind of patient care. So making these little counseling rooms came later, with these private spaces, but they're not so private. And sometimes the door is open or the window of the door is see-through. So it's not private at all, right? So we went in and said, okay, we have to create spaces that make sense for where people wait, where they can be sitting, and put signs so people know where to go, so it's not confusing, and so they know you didn't forget about them, and create some kind of flow, okay, in the pharmacy. And then for the places where you might vaccinate, which sometimes was in the middle of the pharmacy, we said that's not going to work. So we're going to find these counseling rooms or find these places and make sure that they're actually private. So if there was a glass that was see-through, we're going to put some of that opaque, film on it so people can't see through. Going to make sure the door is closed. And again, we're going to decorate the pharmacy so that there's signs about cards so people know what to do. So we implemented more stuff like this, make sure the pharmacy wasn't cluttered. When they walked into the counseling room, it didn't look like a mess, which usually it looks like if you've ever been in one. There's boxes everywhere. Sometimes there's syringes and needles all over the table. It's just a disaster. People don't feel comfortable. We said you need to create spaces where people feel comfortable and relaxed. Let's clean it up, take away the needles, and let's put posters and nice things for people to look at. Because even if you don't really want to be distracted, if you see things that are nice and pleasant, it kind of affects you in a positive way. Conversely, if you see things that are triggers and can be fear cues, you're going to get more nervous and just not be relaxed. So we could change some of those things in the pharmacies that can be permanent changes. And as we became more sophisticated, like I said, we started actually when people came in, no matter how old you were, giving them surveys to say, here's your card checklist. So tell them the spiel, like I said before, we're trying to make your experience as comfortable as possible. Here's a checklist. Tell us what you would like us to do. And people took off what they wanted. And we became more sophisticated with that in that when we started, it was a word checklist. Okay, so people had to read. And we found that this was actually challenging for some people, elderly people, for example, that might come to the pharmacy, but they didn't bring their reading glasses. And so this became hard for them. In one of the pharmacies wanted to have the patients fill in checklists or do things on the computer. That was also very challenging. So we changed it up. So as we learned and did more, we changed the checklist so that it was pictures and words. So then that helped everybody, actually. Didn't just help the older persons, even kids or everybody else, because it's easier for us to process pictures than it is for us to process words. So we made some of those accommodations and integrated them into the process so that when people, like I said, check in, then even if they don't know about CARD ahead of time, they get this and they get the opportunity to tell us how they would like it to go. And most people are okay with that. Like that's interesting because now it's not, you're just not collecting information for yourself all the time. You're actually collecting information to help me, which normally we don't do.
Mm-hmm.
So I don't know if that helps, but I think it's more of a, what can you do in the area if it's like tight, and you can always put up a poster so that the person is empowered. And that's really the most important thing. And inviting that person to tell you what they want. I think that's kind of the bottom line, the most important thing. And then you can add on, right? Like, so you can do the survey too, make people tick off a box. You can have some distraction items so that if people don't have something to do, like their own cell phone or something, they can have something that you give them that's very low cost. Or, we used to do stuff like this before, if people remember, magazines or things in clinics. They went away, some of them came back, but we had this little thing of kind of items for people if they came to be vaccinated so that we could give them something to do that they appreciated.
Mm-hmm. Yeah, absolutely. So I do want to go to just two questions that we have in the chat here. So Shmuel, who is one of our regular contributors at the Global Cafe, is asking how technologies can support reducing pain during vaccination for older people. So I'm not sure if you have any experience with that.
Yeah, so we've gone low tech. So maybe I can ask that person what they're thinking of exactly. From a pain intervention perspective, certainly people have gotten very technically complicated with sort of the things they're studying. So studying stuff like virtual reality or robots or things to make it better, but that's not necessary. Like none of that stuff is necessary. I'm wondering what you're specifically thinking about with technology. Are you thinking about maybe keeping track of people's coping, like being able to refer to things in the future so that we know the preferences that people have? Or are you thinking more like this, like a pain intervention that's tech driven in a tech way.
Mhm.
Is that person
Mhm.
here? I don't really see
Yeah.
their name on what I can see.
Yeah, maybe we'll just maybe I'll go to the next question and then we can come back to that one just to give them a moment to put something in the chat. So we do have another question from Eileen who's asking, do you have any views on the benefit of doing muscle exercises on the arm before injection? And she's mentioning that this kind of helps the healing process.
Okay. Well, from an acute pain perspective, which is what I'm going to talk about, a more relaxed arm is probably better than a tense arm in terms of acute pain. So that's one of the reasons we tell people to, make their arm loose and jiggly or like spaghetti so that it's not a tense arm, a tense muscle, which can hurt more. And then with respect to exercises, we don't necessarily know, other than this, that uh, an exercise is going to make a difference. We do have a type of exercise intervention for people who get faint or dizzy, which is muscle tension, which sounds a little bit like what you're saying, but that involves tensing up large muscle groups and trying to maintain your blood pressure so that the blood pressure doesn't drop and people get faint or dizzy.
Mm-hmm.
That usually we don't recommend for the arms. We recommend for the legs. So like if you're sitting down, pressing down on your heels or squeezing your legs together. And for kids, we usually put a ball between their legs or something, and we kind of ask them to squish their legs together so that they can maintain the tension in their muscles. With arms, usually what we want people to be relaxed, at least the arm that you're giving the injection is in. So we don't tend to tell them to tense up those arms at all, either one, because people usually tense up both because it's hard to control one arm versus the other, or people have difficulty in the moment. So I'm not sure if that's helpful to you or addresses your question. Hopefully it
Mm-hmm.
does in some way.
Yeah. Yeah, Eileen, I see that you put just another. Did you want to have a follow-up question or respond at all to?
Yeah, thank you very much, Dr. Anna. What we're hearing is that it's supposed to increase the effectiveness, to boost the effectiveness of the vaccine.
Yeah, so maybe after you want to, make sure that the vaccine is moving around the muscle, right? And that you're kind of shaking your arm or doing something to help it do that. Yeah, so I can look
Well,
into
well,
that.
sorry. When I say before, maybe a week before, I'm not talking about the half an
Oh, a
hour,
week.
etc. I think it's having muscles that are strong enough,
Gotcha.
and in this actually increases the effectiveness. And your observation about the blood pressure, yeah, that's well taken. I think that's very good. Thanks.
Okay, well, that's a great point that you said. I'm going to look into it now.
Yeah.
Now that you said it, I'm not aware of that, but that might be true. And where did you hear that, by the way? Is that something you had been doing,
Uh,
or?
yeah, we go. One of our previous cafe speakers, who is one of the Global 50th, it was well known. In particular, I think it seemed to have come up after the vaccinations on COVID.
That's great. Thanks for that. So I
But
can.
but I can't give you the references from the citing the research, but it's a sort of a view we're here.
Yeah, but maybe Katrina can help me after, and then we can connect things. So it's always good when people bring ideas from other sessions because then it helps us know more than what we know. So if I know this, then this can be kind of part of what I tell people. So it gives me a more comprehensive view of the entire process, right? Like, and so it's not just the acute, which is where I focus, but I can know a little bit more about before and after. So thanks for sharing that.
Mm-hmm. Yeah, thanks so much, Eileen. And we can kind of maybe share a little bit more information on that after the fact as well. So that's great. So I'm just gonna kind of maybe go back to a few follow-up questions that I had on my end. So I'm wondering a little bit about your experience actually from more the healthcare provider side or from the healthcare administrator side. So when you kind of come in to kind of implement these different strategies, what has been the response from the healthcare providers or the administrators, and have they been receptive to, putting the posters up, to reorganizing the space, that kind of thing?
Yeah, so that's a great question, Katrina. And I think that's actually where the biggest challenge to change is. Because we have to start always with somebody who's interested to make their vaccine process better. So if I walk in and say, hey, I have some suggestions for you about how to make this better, if they're not interested in this aspect of vaccination delivery, then it doesn't work. So they're not going to be open to any change. And where the biggest benefit comes from is when people come to us and say, hey, you know what? We're really interested in in our patients and their experiences, or we've noticed, especially in the schools, which is where we started, and our partners at that time were very concerned about the fear that kids were expressing. They said, we need some help. Can you help us? What can we do to make things better? So if we're all coming from that point of view, it makes it a little bit easier. And then it's about the culture of the organization, right? So a lot of this is about teaching people stuff. So a history of pain is that pain is, probably everybody knows, under treated, under recognized, under prioritized, right? Yeah. In the context of vaccination, obviously saving lives is more important than a needle poke. So, and that's perfectly fine. When we first started making vaccines and people only got one vaccine injection or two, it was okay. Not a big deal. Didn't happen that often. But as we increased the burden, as we learned a little bit more about pain and that it could be bad, and we started to do research then to see what we could do to make things better. Now we're in a different place, but actually how people practice, a lot of them stayed the same. So we have a status quo. This is the way we've always done it. It's okay. People aren't really seeing the negative effects or not really connecting that the negative effects are because of before, or we can prevent this person from having a negative effect later. And it's not something we're teaching actually particularly well at school. So this is where we're starting to focus some of our attention, is to try to educate people about this stuff, that one, pain is important during vaccination. Two, there's things you can do. And three, you actually should be doing them because this is part of you delivering this care. So even with other interventions, if we give people treatments that cause harm, we try to minimize those harms. So we need to have the same perspective with pain, is to say, okay, this is a harm that comes from vaccination. It's unintended, and it's important for us to try to minimize it. So we've got to kind of move people along this and then help them to see how this works in practice. So I think we need to educate more now to change what's happening, because people can't change on their own when they've all been trained to do something a certain way. They don't really know the evidence and they don't know how to integrate it. And the people who are planning the vaccines also don't create opportunity for them to maybe change the way things are done. So this is complicated. So as much as, it seems like the person who's giving you the injection controls everything, they actually don't. They're part of a complex system, right? About an organization and how they do things. So we need to get everybody actually to care, and then everybody can help make changes. And the changes are small, like what I've described to you guys. You can see that they're small: putting up posters, cleaning up the spaces, rearranging the way chairs are, making sure doors are shut. Like, this is not hard stuff, okay? But it's more the mindset, this like changing people's mindset and giving them a roadmap for how to actually do this. Because everywhere we go, the feedback is just so much more positive about how the patients have experienced this event. And it's beyond them having less pain or having less fear or being less dizzy. It's when we ask them, can you tell us what your experience was like today compared to the last time you got vaccinated? So no matter what, we have many people saying this was better than last time. So usually if you ask people this question, about a third of people are going to say, oh, it was better. Like, that's just kind of how we are. Like, a lot of us are positive. We just say, oh, it's better. If we use CARD, it's 50%. It's 60% of people say that it was better than last time. And imagine what that means. That is such a general question. Okay. So it's not just about one thing. It's like, was your experience better today or not? It encompasses anything that happened in the clinic, whether it was a mess, whether you waited, how rude people were to you, how, you know, I don't know, how much it hurt, like all these things. But just by even educating, just by trying to help somebody get through this, you impact them in such a positive way and how they remember this experience because you tried and you showed that you cared. I think that's really kind of the essence of it. We don't ever have to be perfect, and we're not, but we can try to help people, right? Like we can do little things, and people really, really appreciate that.
Mm-hmm. Yeah, absolutely. I think that's such a great point, and I think it's an important point in the context of older adults as more and more vaccines are available for older adults. I think this is something that we haven't thought as much about because there was maybe only influenza or only two, one or two vaccines, but now we have such a pipeline of vaccines where, older adults will be going in more and more and will be, healthcare providers will have to talk them through what the different vaccines are and what they mean, but also the experience of delivering the vaccine. So I think that this is kind of an incredibly timely intervention as well on the, for older adults. So I think we're coming to the final minutes of our session here. But you have maybe just one quick question from Dr. Mahesh, which is asking about the site of vaccination, um, whether deltoid or thigh, if that has any difference in pain.
Yeah, we don't have a lot of evidence actually. So people have not done as many studies as you would think to help. But I think that question was only ever addressed in babies where, you know, there's usually a choice given to what site. And I think the bigger muscle actually hurt less in that case. So the thigh hurt less than the deltoid. And, you know, that's probably one of the reasons we don't recommend injecting in the deltoid in babies less than a year old because it's not a big muscle. However, of course, there's caveats to that too, because there's maybe other problems with injecting in legs. So, and in kids, certainly that's harder to access the legs and, you know, disrobing kids, making them more afraid, maybe interfering with their walking from side effects that happen later. So I'm not sure actually a simple question to answer. So technically speaking, maybe a bigger muscle is better, but there's lots of reasons not to do a bigger muscle, probably related to fear and other harms that people may suffer later, like those side effects. And if you're walking on your leg for kids anyway, if they had serious side effects, and which is less common actually with the vaccines now, like our formulations are much better. But if it interfered with their walking, that's kind of a worse side effect than sort of if you inject it in the arm. So is that helpful?
I
Let us
think
know.
so, and I imagine accessing the arm is certainly easier than in most
Yeah.
cases.
Yeah, so there's like things you're juggling different things. And so the actual pain from the poke might be different.
Hmm. Hmm. Okay, so I think we are just in the last 5 minutes of the session. So I'm just going to take a moment to introduce our speaker for next week's session, and then I'm going to hand it back over to you, Dr. Taddio, just for any final key takeaway messages. So next week, we hope you all can join us for our Global Cafe, which will be on reflecting on the aging reality in Brazil with Mr. Antonio. Apologies, Luana, you're gonna have to help me pronounce that last name. But please do join us for that session. Who Antonio is the institutional relations manager at the Institute of Longevity in Brazil. So very much looking forward to that session, and we do hope that you all can join us. And then I'm going to hand it back over to you, Dr. Titio, for any final key takeaway messages for our audience today.
Well, I think first I would say pain hurts vaccination. So pain for sure undermines vaccination. It's a side effect. It's one we didn't pay attention to till very recently, but we have tools now. We have a way to take this barrier to vaccination away. And we should really be thinking about pain as pain management as part of good vaccination practice. So this is something that we should be mitigating and not waiting for people actually to have this problem. We can do better, and hopefully we're on our way to do that. And for all of you that are on the call, next time you get a needle, try to put your cards in action or play your cards and let us know how that worked out.
Mhm. Yeah, thank you so much, Dr. Taddio. I think this was a really informative session, and of course, people can access all of the resources on card. Everything's been put in the chat and is also obviously available on our Global Cafe website. Should people want to go see all the diagram, go see all the pictures, go see all of the tools. But thank you so much for sharing this resource with us, which I think is gonna really help a lot of people and really hopefully have more people get vaccinated and be protected from disease. So thank you again to our audience for joining us every Global Cafe, as well as to everyone at the IFA who helps us put on the Global Cafe sessions, particularly Luana, who's with us every single morning, and wishing you all a really great weekend.
Thank you, everyone. Have a great day.